The Nevada Orthopedic and Spine Center has set the standard for excellence in the Valley for over 20 years. They strive to provide optimal care and get their patients on the journey back to good health.
Joining us now is their newest physician, Dr. Mark Allen, a total joint and revision specialist, rather. Great to have you, Doctor. Welcome.
Thanks, guys. Good morning.
Yes. Well, welcome to the practice.
Thank you.
And we'd love to know a little bit about you. Tell us about your medical training, your history.
Yeah, so I initially started this pathway here in Las Vegas. I went to Touro University in Henderson.
Awesome.
I was here from 2006 to 2010 and then headed out to Detroit for my 5-year residency training. And then we went to Phoenix, we being my wife as well. She's also a physician. We met in school.
Oh,
and in Phoenix, I did my fellowship there, an extra year of training, and then stayed with the group and practiced for 2 years additionally. And then, you know, the opportunity to come back arose, and we were very excited to come back to Las Vegas.
And we're very happy to have you.
It's just so incredible how much training and years of school it takes to be a physician.
A 5-year residency.
It's
Yes.
really
Oh my goodness.
admirable,
It's
isn't
the
it?
reason I never became a doctor. There's a lot of education going on. So explain the advantage of fellowship training, how that you can offer that to your patients.
So, you know, during your 5 years of training, you learn all the facets of orthopedics, but you don't really dive in to the details and the specifics as much as an additional year can provide. And so, you know, you learn how to do a total knee, you learn how to do a total hip, but a fellowship provides an additional year where you're working with other fellowship surgeons who are mentoring you, teaching you how to take care of complications, do very difficult cases, and manage, you know, complications, unfortunately, that do arise. And you learn the techniques, the specifics, and you know, you really hone your subspecialty in for your training.
One of the great things about coming just out of a residency like you've had is you're probably very in touch with the cutting edge techniques for joint replacement. It's a pretty serious field, isn't it?
Yeah, so I mean, I think I kind of think of myself as more of maybe a newer generation type surgeon, right? So, I mean, if you think about the technological advances of you know, even an iPhone is only 11 years old. So, you know, you've got the newer techniques, the newer technologies, we've gotten much better with our patient pain management, discharges. Most of my patients go home the next day. I've sent hip replacements home the same day. I mean, we've completely changed the paradigm of how people used to stay in the hospital for 4, 5, 6, 7 days after surgery and go to rehab afterwards. Everybody goes home now for the most part, if they're healthy enough.
That's pretty
just with some very serious instructions about what to do and what not to
do. Yes, there's always things to follow. Absolutely, instructions.
So at what point, I mean, surgery is not the answer for absolutely everybody. So at what point do you decide, you know, you probably should proceed with the surgery?
Yeah, correct. So, I mean, everybody coming to my office, I mean, I'm a surgeon and I love to do surgery, but everybody deserves the non-operative management. That includes injections, medicines, physical therapy, bracing, but oftentimes there comes a point where none of that works anymore.
Of course.
And my biggest, you know, advice to my patients is, number one, you'll know when it's time. You'll know when your pain is to the point where you can't do the things you want to do. Your quality of life is being affected by this. And then also, they, you know, have to make that decision with their family, with myself. We do this all together to make sure we're doing this at the appropriate time and they're ready for it.
I was going to say, sometimes timing factors into it. Is when can I take time from work, or when can someone help me recover? It's interesting.
Exactly.
So we talked about hip joint replacement, but what are the most common joint surgeries you do at the center?
So my focus is specifically hip and knee replacements.
Wow,
yeah.
There's a lot of work there.
There's plenty of that to go around, and then also with the revisions. You know, there are unfortunate situations, usually less than 1%, where people have a major complication, but there are infections that do arise that require significant amount of time, surgery, multiple procedures. There are, you know, dislocations, instability, loosening, a lot of things that can arise, and that's where patients typically seek me out as well for their care, is to help provide the training that we've taken through fellowship to help get them back when they've had something unfortunately go wrong.
Yeah, it does happen. My Aunt Margaret just had a revision on a hip surgery as well. Yep.
And they can even wear out. I mean, some of them are
Right.
20 years old.
I have a rule. I don't let anyone cut me open that hasn't been to school for a really long time.
Yes.
So this is great. It's great
Yes.
having you back in the Valley,
Good
and thank you so
standard
much
to
for
have.
joining us.
Thank you.
Yeah, great to meet you.
Thanks,
All
guys.
right, the Nevada Orthopedic and Spine Center. They have 2 locations here in the Valley. You can find them on Wigwam Parkway, just west of Stephanie and Henderson, and on Washington Boulevard, just east of Buffalo. Their website and phone number are up there on your screen. You can also find them on Facebook and Twitter. The Nevada Orthopedic and Spine Center is a proud sponsor of the Morning Blend.